Hello, everyone. Welcome to your Fluid and Electrolyte Fundamentals lecture. There's going to be a few things we're going to be going over. I'm going to read your objectives. So the objectives for this PowerPoint or this slideshow are describe the location and function of body fluids, including the factors that affect variations in fluid compartments. Understand the physiology of intake and output. Briefly describe the following fluid imbalances: fluid overload, fluid deficit, and dehydration. Understand how urine-specific gravity, hematocrit, sodium, and osmolarity change with fluid overload, dehydration, and fluid deficit. Describe the signs and symptoms of dehydration, fluid deficit, and fluid volume overload. Describe how thirst and organs of homeostasis, for example, kidneys, heart, blood vessels, lungs, adrenal glands, pituitary, parathyroid glands, function to maintain fluid homeostasis. Describe the various electrolytes in the body and their normal values. Identify etiologies or causes and signs and symptoms of common electrolyte imbalances. Perform a fluid and electrolyte balance assessment. Apply the nursing process to address fluid and electrolyte imbalances. Identify appropriate nursing interventions and client teaching when administering potassium and sodium supplements. All right. So let's talk about body fluids. You want to know what it's for? Why do we have it? What is the primary role of body fluid as water in our body? How does water function in the body? As you can see it on the PowerPoint, water in the body transports nutrients to cells and waste from cells. It transports hormones, enzymes, blood platelets, and red blood cells and white blood cells. Facilitates cellular metabolism and proper cellular chemical functionings. Acts as a solvent for electrolytes and non-electrolytes. Helps maintain normal body temperature. Facilitates digestion and promotion of elimination. Acts as a tissue lubricant. Know that the total body or fluid in a person's body is about 50 to 60% of the weight. What this means is what the total weight of fluid a person has. So it accounts for 50 to 60% of a healthy person's weight. And it will vary based on the person because every single person has a different body composition. Let's move on. So if you take a look at the figures here, these are found in your fundamentals text. It gives you good information on how it accounts for 50 to 60% of the body weight and what each fluid compartment accounts for in this. And there are two huge compartments that you will need to know and how they affect our fluid balance. So let's talk about what are the variations in fluid content. So the normal variation in fluid can change depending on the actual person. What we do know is that fluid content in a person's body accounts for 50 to 60% of their weight. So for example, if someone weighs 140 pounds, at the highest 60% of their body weight in water it accounts for 84 pounds of that. And the different factors that make a variation in fluid content include age, amount of body fat, and even biological sex. Excuse me. Per your fundamentals textbook, an infant has a more total body fluid because when they're much smaller and they have less body fat, and it is found in their extracellular fluid. That is compared to an adult, and this is why infants are at very high risk for fluid deficiency or dehydration. Other factors include fat cells, which contain little water due to their hydrophobic nature, in contrast to lean tissues such as muscles, which hold more water. And think about an obese person has less water versus a smaller person whose percentage of water will be greater. And that is because the more fat they have, the less water content they will have. And fluid balance is how the body regulates the ingestion of fluids and excretion of fluids. The body has a way to ensure there is a balance. For example, the thirst mechanism. So the thirst mechanism is found in the hypothalamus, helps the body intake water when fluid volume is low in the vessels. It is controlled intracellularly due to dehydration of the cells. Humans get more of their fluid from drinking large amounts of liquids, about 1,500 mLs, and about 800 mLs comes from food, and then that last 300 mLs, it comes from metabolic oxidation. And remember, this is for a healthy person, and this is how they maintain fluid balance. So a healthy person should be ingesting about 2,600 mLs of fluid a day. Doesn't matter what kind of fluid, as long as they're ingesting the right amount. The other thing is fluid balance also includes the output. So if you look at the picture, figure 41-2, it shows you roughly fluid intake and then roughly fluid output, and what is outputting should be relatively equal. You have to know that healthy humans have what's called sensible loss and insensible loss. Sensible means it is measurable, such as urine, feces, vomit, wound drainage, and blood, while insensible loss is not measurable, such as sweating and exhaling. Fluid output is or should roughly be equal to 2,600 mLs, but make sure you understand that sometimes that balance can occur even after 24 hours. So, think of all the things we do. In Arizona, we sweat a lot because it's so hot. So that 2,600 output might not be exactly 2,600 because we sweat more. Thus, less is outputting in that sensible loss versus the insensible, where we can't truly measure sweat. Excuse me again. Electrolytes. What are they? What are the electrolytes, and where are they found in the body? I believe I like this figure 41-3 from your fundamentals text, because it is telling you plasma, interstitial fluid, and cellular fluid. So it's showing you in which compartment each type of electrolyte is found and where it's more abundant. It's a nice visual if you're a visual person, but it's important to know where each electrolyte is found and what compartments they're found. So we know electrolytes are electrically charged substances that can break into smaller pieces called ions. There are two major types of ions. They are called cations, which have a positive charge, and anions, which have a negative charge. Electrolytes and their varied charges are responsible for the chemical interactions that are needed for metabolism and other bodily functions. The major cations in the body are potassium, sodium, calcium, and magnesium, while the major anions are chloride, phosphate, sulfate, and bicarbonate, but we focus on chloride and phosphate. And if you take a look at that figure again, you can see the electrolyte content varies in each of the fluid spaces. The major electrolytes found in the ECF or extracellular fluid are sodium, chloride, and calcium. The major electrolytes found in the intracellular fluids are potassium, phosphorus, and magnesium. A healthy person maintains a narrow balance of their electrolytes, and any changes in the balance, the person is at risk for alterations in their health. What that means is the body needs to maintain a state of homeostasis, which means it's in equilibrium, everything is working as it should. And as you can see, based on the type of electrolyte, there are small numbers. If changes for whether high or low can have a significant alteration in somebody's health. I wanted to go back to this slide so that you understand where each electrolyte is found. So the compartments are as followed. We have an intracellular fluid compartment, which is the fluids that are found within a cell, and it constitute about 70% of the total body of water or 40% of the adult's body weight. This is your intracellular, so everything inside these cells. So whether it's inside this cell or any kind of cell, it is the fluid found inside of that. Versus your extracellular fluid, which is the fluid found outside of the cells, which accounts for about 30% of the total body of water or about 20% of the adult's weight. So if you look at that, that 20% plus 40% equals 60% the total body weight. But each compartment has a certain amount. In the extracellular fluid compartment, it includes two major areas, which is the intravascular fluid compartment and then the interstitial compartment. There is a small percentage, and it accounts for about, I want to say it's a 1 liter, 1,000. It's about 1%. And it's called the transcellular fluid, and this transcellular fluid is usually found in places such as the cerebral spinal fluid, pericardial space, synovial fluids, pleural space, and it is a very small amount. In the extracellular fluid, the interstitial fluid is the fluid that surrounds tissue cells. That can include limbs. And then there's the intravascular, which is the liquid component of blood, or also known as plasma. So if you see here, extracellular can be here, surrounds tissue, right? Like veins and arteries. But it can also be found inside the vascular space, which is plasma, that surrounds the cells that circulate through the body. And so you have to know where each space is, because you also want to know which electrolytes are abundant in or out of the spaces, and how the shifts can have a drastic effect on a healthy person's body. All right, let's move on So, how does our body regulator keep homeostasis of fluid and electrolyte balance? One of the biggest things is our organ and body systems do that. And I will go through what that is. But there are also other processes. First, you must know what homeostasis means, and the very definition, and you can find this in your textbook, is homeostasis maintains a constant internal equilibrium of all of our biological systems. So a healthy individual will have homeostasis because their body is in balance. They're not sick. There's nothing out of the ordinary. Versus somebody that's not in homeostasis because maybe they have a fever. So something is happening in the body that's causing that person's temperature to rise, which can cause an imbalance in that equilibrium, which means that they're not in homeostasis. And then the body throughout will have different processes for maintaining homeostasis, and they kind of also have backup systems to help maintain homeostasis. This is why our bodies, even when we're sick, we're still functioning until we're not, which means that the body is so out of whack that we're no longer in that homeostatic state. And the body processes are as follows. So osmosis is when water or the solvent passes from an area of lesser solute concentration and then moves more water to an area of greater solute concentration, and less water until equilibrium is established. Osmolarity is the concentration of particles dissolved in a solution. It is referred to as osmolarity of a solution, which influences the movements of fluids between compartments. A normal serum osmolarity is 275 to 290 milliosmolar. I can never say it, milliosmoles. See Table 10-3 in your MedSurg textbooks on how osmolarity is affected with special attention to fluid balances. Isotonic solutions or processes is when a fluid remains in the intravascular compartment without any net flow across the semi-permeable membrane. What that means is that isotonic is even on both sides of the compartment and that there is no movement between it. Hypertonic, and it's a process, but typically they're solutions. Hypertonic solutions have greater osmolality, and then that causes the solution with greater osmolality. It moves water out of the cells and it draws it into the intravascular compartment, causing those cells to shrink or shrivel up. As opposed to hypotonic, where the solution has a lot less osmolality than plasma, and because of the lower osmolality, a hypotonic solution in the intravascular space moves out of the intravascular space and into the intracellular space, causing the cells to swell and possibly burst. Diffusion is the tendency of solutes to move freely through a solvent. The solute moves from an area of higher concentration to an area of lower concentration until it is equal on both sides. Active transport, you must remember that active transport requires energy. That's your ATP, so that substances can move through the cell membrane against a concentration gradient, meaning from an area of lesser solute concentration to an area of higher solute concentration. And then capillary filtration. Capillary filtration results from the force of blood pushing against the walls of the capillary and then moving particles through that membrane to get through. Think of how the capillaries at the alveoli work. They work by that force of blood from the heart pumping to have that exchange of oxygenation occur. So, as you can see here, I want you to take a look at the tables listed. What the first table I want you to see is 41-1. That is your major electrolytes in the body, what they are, and what their serum levels are. And serum levels means what they are in the blood. So a serum electrolyte, so serum potassium, serum sodium, serum calcium, what that's telling you, it is the lab value of the amount of the corresponding electrolyte found in the blood, which has a high and a low end, and anything below and anything above is hypo or hyper. For example, in the table 41-1, you have sodium, which is what we call the chief electrolyte in the extracellular fluid. So that is found outside of the cell. And the normal serum concentration is 135 to 145. On that table, you can also see that they have a nice little list of functions, sources, and how it is regulated. This table is going to be key in understanding your electrolytes. So for example, in sodium, we can see the list here. It says it regulates extracellular fluid volume. So sodium regulates the fluid that is found outside of the cell, and you're going to hear sodium follows water as a way of saying that anywhere water is, sodium is, and any imbalance causes a lot of havoc on the body. Other functions sodium has in our body are it plays a role in muscle contraction and in nerve impulses. We know this through the sodium potassium pump that we learned way back when we were in like chemistry. Sodium affects serum osmolality. Sources, so you want to know where sodium comes from. For most humans, it's through our food. We actually, at least in the American diet, intake too much sodium, which can cause a lot of conditions such as hypertension. So, you know, we know foods that are high in sodium, like canned foods, snack foods such as chips, Cheetos, and stuff like that, and how it gets out of our body. It's that we lose it in our GI tract and our kidneys and through our skin. If you've ever worked out and your skin after sweating feels kind of coarse, that's actually salt on your skin. It's from the sodium that comes out of your sweating. What does sodium do in the body? Well, it's transported out by the cell through the sodium potassium pump. How is it regulated? By the RAAS system or RAS system, so the renin angiotensin aldosterone system. It is eliminated and reabsorbed by the kidneys, and sodium concentrations are affected by the amount of salt we intake and the amount of water we intake. So I want you guys to look at this table and ensure that you're understanding where the electrolyte is, where it's found normally, and what the functions are, sources and losses, and what the regulation is. I want you to also look at table 41-2 found on page 1674. And this is the table that's going to tell you the organ and body systems related to the regulation of fluid and electrolytes. Look at this table and know how each of these organs or body systems functions to maintain our fluid and electrolyte balance. An example, and you can see here, is the kidneys. They regulate the extracellular fluid volume and osmolality by selective retention and excretion of body fluids. Regulates electrolyte levels in the extracellular fluid, again by that selective retention of needed substances and excretions of unneeded substances. That's the filtration. That's what the kidneys does, right? Somebody that is undergoing dialysis will have a higher sodium serum sodium or a higher serum potassium, even though we want it to be at the regular or normal levels. But if they skip a dialysis session, then the kidneys don't work and they don't eliminate those substances as they should, and so they accumulate in the body. Again, it excretes metabolic waste, and the kidneys filter 180 liters of blood daily, which is a whole lot, which means that we're actually excreting 1 to 2 liters of urine per day, which is close to that 2,600 milliliters if we ingested the right amount of milliliters of 2,600. So take a look at this table. You're going to want to know how the organs and body systems help maintain that homeostasis in fluid and electrolyte balance. All right, what are the electrolytes and what are their normal values? Again, you can find this information on that table 41-1. Sodium is 135 to 145. Anything below 135 is too low. Anything below higher than 145 is too high. Potassium 3.5 to 5.0. Calcium is 8.6 to 10.2. Magnesium is 1.3 to 2.3. Chloride is 97 to 107. And phosphate is 2.5 to 4.5. So here is a list of the fluid volume and electrolyte imbalances that you're going to see. You have fluid volume deficit, which is there is less fluid volume in the body than there should be. And that's not to be confused with dehydration, because dehydration has to meet certain requirements. But it is, so dehydration is a fluid volume deficit, but it is not completely fluid volume deficit. And then there's fluid volume excess, which means there's an overaccumulation of fluid in the system. Think of somebody with heart failure that isn't able to pump out enough fluid, so it accumulates and it causes edema. Hypernatremia and hyponatremia is pertaining to sodium. Hypokalemia and hyperkalemia is pertaining to potassium. Hypocalcemia and hypercalcemia is pertaining to calcium. Hypomagnesemia and hypermagnesemia are pertaining to magnesium. Then hypophosphatemia and hyperphosphatemia is for your phosphate. And then hypochloremia and hyperchloremia is your chloride. You will want to know what is what are these imbalances, and what levels mean they are in that imbalance. So, for example, hypokalemia is somebody that is less than 3.5 serum potassium. And then somebody that's hyperkalemia is that their serum potassium is above 5.0. You're going to need to know how to take care of your patients with these fluid and electrolyte imbalances. So my recommendation is it, um, either using concept maps or making charts to describe the various fluid and electrolyte imbalances, what their signs and symptoms are. I am going to make a separate video for, at minimum, hypernatremia and hyponatremia, hypokalemia and hyperkalemia, to give you examples of how you should learn the fluid and electrolyte imbalances. You're going to want to go through the nursing process in fluid and electrolyte imbalances. You can actually see this in tables 41-3. And that has really good information regarding the nursing process and these imbalances. You're going to want to know what you need to assess your patient, and what implementations the nurse needs to do, some goals, what are the problems. So let's just kind of see what this box 41-3 looks like so you can see where to find this information. Here we are. So here are your general assessment. This is the box that I want you guys to look at. So parameters to be considered in a physical assessment for a fluid, electrolyte, and acid-base balances. However, just remember we're not doing acid and base balances. So skin turgor, it's a huge, huge indicator of fluid volume status. So it can show you if somebody is dehydrated, what we call tenting. So when you pinch the skin and it stays up and it tents, that means somebody has poor skin turgor. The tongue, so dry mucous membrane, so seeing the moisture of the oral cavity. Is the patient able to produce tears? Because if they're not, they're probably super dehydrated. The skin temperature, edema. So these are the different assessment data you can collect on somebody with either a fluid or an electrolyte imbalance. Then I want you to look at how some blood levels will increase and decrease based on the fluid status of the patient. So an example here, you can look at that increased hematocrit is found in people with severe fluid volume deficit and shock. A decreased hematocrit can also be found with somebody with having massive blood loss. So their hematocrit. So hematocrit is the percentage of blood found in the vessels. Other things you can look at is this table 41-1. So parameters again for fluid and electrolytes. So looking at urine concentration, and then I want to talk to you guys about body weight. So remember earlier we talked about the total fluid body weight in a healthy person is around 60%, right? A drastic change in weight is going to indicate someone's fluid status. This is the most accurate indicator of somebody's fluid status. So body weight, we measure someone's weight daily at the same time using the same scale, the same mode, because we want to see if there is a huge shift. We know that a gain of 1 kilogram equals a gain of 1 liter. So 1 kilogram equals 1 liter of fluid. So if somebody loses 3 pounds in overnight, that means they've lost 3 liters of fluid, which is a lot. So again, let me state it again. Body weight and having a daily weight for people with fluid and electrolyte imbalances is significant because it is the most accurate indicator of a fluid shift. So you have to know that although intake and output does give us a good account of somebody's fluid status, weight is the most accurate. And again, you also must know the conversion of 1 kilogram equals 1 liter of fluid. So if you have a question that says a patient has lost 6 kilograms in a week, you're going to know that they've lost 6 liters of fluid in a week, which is a lot. You can look at, again, this table, and then you also want to look at the focused assessment. So the type of questions you want to ask your patient. What's your usual intake pattern? Usual pattern of fluid elimination? So these are questions focused on getting information about somebody's fluid and electrolyte status. Like, does the patient eat a lot of canned processed foods? That's going to tell us why they have hypernatremia, things like that. We want to ask these questions to ensure we are focusing the assessment part on fluid and electrolyte status. We will definitely go more in depth with the nursing process and your fluid and electrolyte type patients, but here are your nursing diagnoses or your priority problems that you can have for certain of the fluid and electrolyte imbalances. Excess fluid volume is itself a actual problem. Deficient fluid volume, again, is an actual problem. And risk for deficient fluid volume or excess fluid volume are also priority problems. These are risk for, so they have not yet, they are not showing enough signs or symptoms to completely be in a deficient fluid volume status. Other things for electrolyte disturbances, we know that, well, you'll learn that potassium has a lot to do with heart muscles, and potassium can have a nursing diagnosis of impaired, not impaired gas exchange, but ineffective tissue perfusion. If they have too much potassium in their body, their heart can actually stop working, which will then stop perfusing. So we're going to go through these and ensure that you're understanding how to go through the nursing process with each fluid and electrolyte imbalance. Some outcome identifications and planning. So these are your goals. Remember, here I'm not writing them in the SMART format just because we don't have an actual patient to make a potential goal for them, but our goals should be derived from the actual and potential problem. So maybe the patient is at risk for injury because they are dehydrated and they're dizzy and have orthostatic hypotension. So, those things mean that they could potentially fall and injure themselves. So the priority problem is risk for falls, and our goal should be to prevent the fall, right? So that can be how we write our goal. The goal is to maintain or restore optimum function of the patient with the problems they're having via the fluid and electrolyte balance. We have to then intervene. So we have interventions that we want to ensure are occurring so that we meet our goals, right? Use bed alarms, ensure that there's hourly rounding, assess the patient for further fluid and electrolyte imbalances, take vitals, ensure that the patient is drinking fluids if the problem is fluid volume deficiency. You know, that is how you plan. All right. So these are your implementations: dietary modifications, modifications of fluid intake, medication administration. IV therapy is a huge one with fluid and electrolyte imbalances. Obviously, in block 1, we don't do them, but you must know that there is IV therapy as a potential thing. And one of the biggest things is teaching our patients. We have to teach our patients to cut down on the salt, or maybe they're drinking too much water. Maybe they're not taking their heart failure medication. So we have to educate our patients. How do we evaluate? So evaluation is there progress? Is the patient's dehydration status improving? Are they drinking more liquids? Are they not falling? Is there intake and output balance? Have they gained or lost normal amount of weight? Is the patient back to their baseline and able to practice their self-care? And as with any evaluations, they should be ongoing as we plan the care. Of course, if they meet certain outcomes, then we can terminate them. However, a lot of the times it depends on the patient, and we might have to change what we're doing. So stay tuned, and we will work on a fluid and electrolyte imbalance care plan so that you can understand how to approach your fluid and electrolyte material. Thank you, guys.